Hello, my name is Dr. Esther Palacios Barrios, and welcome. Today we will be discussing neuropsychological assessments. The purpose of the video today is to help adults and parents of kids and teens understand what neuropsychological assessments are, who administers them, and the process for undergoing a neuropsychological assessment for adults, children, and adolescents. And here at the Ross Center, we are committed to providing an inclusive and welcoming environment for all patients and members of our staff. So here's our outline for today. We will be discussing what is a neuropsychological assessment and when they are indicated. We will also be discussing who administers neuropsychological assessments and discuss an overview of the assessment process and what it looks like at the Ross Center specifically. So what is a neuropsychological assessment? So they are a comprehensive evaluation of functioning in one or more of the following domains. So the first is academic, and these involve tasks that assess one's ability in mathematics, reading, and writing. There are also tasks involving cognitive abilities, including one's ability for attention, executive functioning, intelligence, language, memory, and learning. And neuropsychological assessments also assess social, emotional, and behavioral functioning. This includes adaptive functioning or one's ability to function in day-to-day life, and also includes a measure of many measures of emotion regulation and symptoms associated with things like anxiety, depression, as well as personality assessments. And finally, there could be additional neuropsychological functioning tasks that look at other abilities, including sensory motor functioning or visual perception. So this can include tasks where one looks at visual stimuli and we examine how that contributes to one's sensory motor processing or one's ability to, for example, use their hands to write things on paper and pencil. So when a neuropsychological assessment is indicated, is when there is a suspected impairment in one or more of the domains of functioning that we just discussed. And this could be due to a potential medical or psychiatric condition. So it really provides clarity on what could be going on. And also, it provides insights into specific cognitive strengths and weaknesses. So, what are specific domains of functioning that could be a strength for an individual that we could leverage, or a weakness for an individual that we could target? It also provides diagnostic clarification of diagnoses that could help clarify and account for these symptoms and what's going on. And importantly, neuropsychological assessments include treatment recommendations, and these recommendations inform individualized intervention strategies. They inform educational accommodations for school, including elementary school, high school, all the way up to college. And they also provide recommendations for therapeutic approaches that could really help target the cognitive domains that were assessed. And importantly, neuropsychological assessments can track changes over time. So they monitor these symptoms and the progression of either the disease or the effectiveness of the interventions that have been tried. So for adults, at the Ross Center, we see many common presenting concerns that could include concern for ADHD, so attention deficit hyperactivity disorder. So adults might have concerns with their attention, working memory, concentration, executive functioning, things like that. We also do assess for autism spectrum disorders, as well as memory complaints or cognitive changes, in addition to neurodegenerative conditions like dementia, post-concussion or traumatic brain injury, as well as social and emotional concerns, including difficulty with emotion regulation, struggling with depression and anxiety. So these are just some presenting concerns that we commonly see here at the Ross Center for Adults. For kids and teens, in general, we see ages 18 and up to 17. And this could include for admissions testing, so looking at just cognitive abilities for admissions into schools. We also assess for cognitive and intellectual ability. A lot of times, kids and teens are also presenting for those concerns for ADHD symptoms, again, difficulty with attention, working memory, executive functioning. We do also administer testing for autism spectrum concerns in kids and teens. And commonly, we do see kids and teens that are struggling with learning difficulties or concerns for academic performance. And finally, social and emotional concerns. So again, those concerns regarding emotion regulation, symptoms of depression and anxiety. So these are all very common reasons why kids and teens typically seek testing. So now regarding who administers neuropsychological assessments. So these are typically conducted by licensed professionals, and specifically a licensed clinical psychologist or neuropsychologist. And there is some confusion about the difference between the two, so I did want to take a moment just to highlight that. So actually, a neuropsychologist is a type of clinical psychologist. So clinical psychologists and neuropsychologists all receive the same training and academic trajectory. However, I did want to highlight the critical differences between the two and where they might get additional or supplemental training. So, a licensed clinical psychologist or neuropsychologist both have the following educational and training backgrounds. So, they both have a doctoral degree in psychology. So, this could either be a PhD or a PsyD from an APA accredited university training program. Both a clinical psychologist and a neuropsychologist complete a 1-year internship, sometimes called residency, program in psychology. And following this, many clinical psychologists have additional training of a 1 to 2 year postdoctoral fellowship where they receive specialized training in psychology and are supervised by a licensed clinical psychologist. So here at the Ross Center, many of our clinicians who administer neuropsychological assessments actually have these additional years of training in completing developmental and educational assessments in particular. Neuropsychologists, and here's where they differ from clinical psychologists, complete a 2-year postdoctoral fellowship that is specialized in neuropsychology specifically and supervised by a licensed neuropsychologist. And neuropsychologists tend to have specialties including, for example, seeing more geriatric populations and testing things like dementia. So I just wanted to highlight those differences and really emphasize that here at the Ross Center, our clinical psychologists have extensive training and experience, in particular in developmental and educational assessments for kids, teens, and young adults. And we do meet as an assessment team and routinely make sure that we are consulting and sharing that expertise with one another, which is really great bonus. So now I wanted to discuss the overview of the assessment process here at the Ross Center. So first, it starts with a consultation session, and based on that session, we may recommend to proceed with testing. And then after the testing session, there is a report writing period as well as a feedback session. So I just wanted to talk about each one of these components in more detail. So, in regarding the consultation session, here at the Ross Center, we offer a very unique consultation sessions that many other practices don't offer. And these consultation sessions are with the director of psychological testing or a senior member of the assessment team. During this meeting, they will provide a personalized recommendation for a testing plan that is optimized to meet your needs and also taking in consideration financial cost. So in this consultation session, The director of testing or a senior member will gather background information, understand your presenting concerns and your motivations and goals for testing. They will collect information regarding relevant educational, medical, and psychological history. And again, at the end of that meeting, they will make a recommendation of which testing procedures, if any, would make sense to proceed with. And again, we'll take in consideration financial costs of what makes sense and what your goals are. So this meeting tends to be 1 hour and virtual. So following that consultation session, if testing is indicated and the testing has been agreed upon, we will proceed with testing sessions. And what that looks like is you will be assigned to a clinical psychologist who will complete the testing, and this will involve clinical interviews, standardized tests, computerized tests, and even informant reports, so questionnaires for yourself. And if there are kids and teens, they may complete questionnaires, parents may complete them, as well as teachers. And these tests are tailored to the patient's age and presenting concerns. These sessions could be multiple sessions, and each session could last as little as an hour, but could go up to 4 hours. So there tends to be multiple sessions just to make sure that there is enough time to really capture all of this information and conduct all these tests. So once those sessions are completed and all the testing has been done, there is a report writing period. And during this period, the clinical psychologist will score all of the results of the tests, and then they will interpret the results and make sense of the strengths, the weaknesses, and other things that come up. And this will help the clinical psychologist formulate a case conceptualization of what is going on, including diagnostic interpretations. The clinical psychologist will comprise a comprehensive report detailing all of the findings as well as treatment recommendations, as discussed earlier. And because this process truly takes a lot of time and consideration for the assessor to process all of the information and the results and to write up this extensive comprehensive report, the duration could take 4 to 6 weeks to make sure that that report is finalized. Once the report is finalized, there is a feedback session where the assessor will meet with you and your child, potentially as well, to review the results and discuss the treatment recommendations. And this tends to be one session. It tends to be virtual as well, and it can last anywhere from 1 to 2 hours. So if you would be interested in getting any assessment neuropsychological testing at the Ross Center, please contact our office to schedule that initial virtual consultation session to discuss your goals and how we could meet those goals. And we look forward to working with you. Thank you.